Okay, let's dive in. You sent over some really interesting material about something critical, especially now in India, keeping your health data private and secure.
That's right. We're doing a deep dive into data privacy and security in Indian healthcare,
Mm.
looking specifically at how your information, your really sensitive health information, is protected as everything moves more digital.
Yeah, and our goal today really is to sift through all that material you shared, pull out the key nuggets, the important insights, so you can understand what's going on behind the scenes to protect your data.
Especially with things like ABHA, electronic health records. India's digital health adoption is moving fast.
It really is, which makes securing that data just paramount, doesn't it?
Absolutely. And the sources you sent, they really highlight that data privacy, security, even things like algorithmic bias and definitely regulatory compliance, these are huge considerations, especially with AI entering the picture more.
Right. So this deep dive is about unpacking all of that for you, the listener.
Exactly. Starting with, well, what are the actual threats? It's not just one thing.
No, it's easy to just think hackers, maybe, but the sources break it down much more broadly.
They do. First up, there are the human threats.
Okay, so that could be insiders, like employees.
Yep, insiders maybe making an unintentional error or
Mhm.
sometimes, unfortunately, acting maliciously, but also external actors, the hackers trying to break in.
Okay, human threats. What else?
Then you've got natural and environmental threats. Think earthquakes, fires, major floods, things that can physically damage the systems holding the data.
All right, stuff you can't easily predict or control.
And the third category is technology failures. Simple things, relatively speaking, like a server crashing, a software bug.
Things break sometimes.
Exactly. Not malicious, but they can still knock systems offline or, if not handled right, maybe even expose data.
So these threats can be internal, external, intentional, unintentional. It's a wide range.
It really is. And one point the sources made that stood out, maybe a bit concerningly, was about the lack of security awareness sometimes found among healthcare professionals themselves.
That's a big one, isn't it? Because the best technology doesn't help much if the people using it aren't fully up to speed on the risks.
Precisely. So, okay, those are the threats. The next logical step the sources cover is the defense, and it's described as needing multiple layers.
Not just one silver bullet.
No, definitely not. Protecting sensitive health data needs, well, layers. Technical measures, administrative rules, and importantly, legal requirements.
And the legal side seems foundational in the Indian context, based on the sources. Compliance is mentioned repeatedly.
Absolutely foundational. You can't really implement these big digital health solutions in India without strictly following the data privacy laws.
Which laws specifically are highlighted?
The main ones coming up are the IT Act, the more recent Digital Personal Data Protection Act, the DPDP Act,
Okay.
and also specific guidelines from bodies like the National Health Authority, NHA, and the Ministry of Health and Family Welfare, NOHFW. Adhering to this whole framework is presented as non-negotiable.
Got it. So the legal framework is layer one. What about the technical side? What specific measures do the sources talk about?
They get into the nuts and bolts, things like data encryption, which is essentially scrambling your data so it's unreadable without the right key.
And that's for data just sitting on a server.
Yes, data at rest, but also crucially, data being sent across networks, data in transit. Both need that encryption layer.
Like a secure digital envelope. What else?
Access control. This is huge. Making sure only the right people, the authorized individuals, can actually see or change specific pieces of data.
So not every doctor or nurse can see every patient's full history. It's role-based.
Exactly. Role-based access is key. You only get access to what you need to do your job. And given the mention of internal threats or errors, this is critical.
Makes sense. Any other major technical ones?
Audit logging.
Mhm.
Basically keeping a detailed record, who accessed what data, when did they access it.
Like a security camera log for the data itself.
Kind of, yeah. It provides accountability and is invaluable for investigating any incidents or just for regular monitoring.
Okay, encryption, access control, logging.
Yeah.
The sources also seem to focus quite a bit on anonymization and de-identification. Why is that so important?
Right, this is really interesting. These are techniques to strip out or mask information that could identify you personally from health records. Think names, addresses, specific ID numbers.
Okay, removing the personal bits.
Exactly. And the sources stress that doing this well, having strong anonymization, is vital. It's essential for protecting your privacy, but also for meeting those regulatory requirements we talked about.
And technology can help here too. They mentioned AI.
Yes, they pointed to AI-powered de-identification tools. These can automatically go through lots of data, like doctor's notes, and pull out that protected health information, the PHI.
So why do this? What's the benefit of having this anonymized data?
Well, that's the key balance. It allows that data, strip of identifiers, to potentially be used for really beneficial things. Think medical research, tracking public health trends, maybe improving healthcare services, even training AI systems safely.
Without revealing whose data it originally was.
Precisely. It allows secondary use of data for the common good, while keeping individual patient privacy absolutely protected. It's a critical piece of the puzzle.
Okay. Now, shifting gears slightly, how do industry standards fit into this? The sources mentioned FHIR.
Yeah, FHIR Fast Healthcare Interoperability Resources. Standards like this are like the plumbing, the infrastructure for how different health systems talk to each other and share data.
Interoperability, getting systems to connect.
Right, and the sources point out that while older standards like HL7 also had security aspects, FHIR really aims to build security in more fundamentally.
Built-in security, how does that work within FHIR?
The sources list several features, things like transport encryption, using HTTPS, the secure connection when data moves between systems.
Like the padlock you see in your web browser.
Pretty much, yeah. Then there's OAuth 2.0 authentication, which is a standard way to verify who or what is requesting the data, making sure they're allowed to ask in the first place.
Okay, verifying identity.
Also, access control using user roles and permissions, similar to what we discussed for internal systems, but applied during the data exchange process.
Got it.
And audit logging is usually part of it too, tracking who exchanged what. Plus, anonymization techniques can be applied within this framework as well.
So the idea is, as more Indian healthcare providers adopt FHIR to share information, these security protocols are kind of baked into the process.
That's the goal. It means security isn't just an add-on, it's part of the basic structure of how data moves around, which, should build more trust in the system.
It definitely sounds more robust, but let's be realistic, breaches still happen, right? The sources acknowledge that.
They absolutely do. It's an unfortunate reality. And when they happen, breach notification is key, letting people know their data might have been exposed.
The sources use the US EpiPay experience as an example here.
Yeah, they did. Not because ABHA applies in India, of course, but to illustrate the potential scale and common causes. They mentioned stats like breaches affecting, I think it was over 176 million patients in the U.S. context over time.
Wow, that's a staggering number.
It really is. And importantly, the sources noted that many of those breaches weren't necessarily super sophisticated hacks, but often resulted from things like employee negligence or just not following the existing rules and regulations.
Which circles back to that awareness issue again.
Exactly. The core principle, whether it's HIPAA or India's DPDP Act, is the same. Protecting patient confidentiality is absolutely vital.
And navigating these complex rules can be tough.
For sure. The sources acknowledge that the complexity can sometimes lead to confusion, which underlines why ongoing education for healthcare professionals is so critical, making sure they truly understand their responsibilities.
Okay, so pulling all this together, if we zoom out, what's the big picture the sources paint for protecting your health data in India?
The picture is one built on robust data governance frameworks. It starts with that legal compliance following the IT Act, the DPDP Act, the NHA, and no HFW guidelines. That's the bedrock.
All right, the rules of the road.
Then you layer on those technical safeguards we talked about. Strong encryption, careful access control, thorough audit logging, and using anonymization where appropriate.
And standards like FHIR help weave security into the fabric of data sharing itself.
Exactly. So for you, the listener, it's about understanding that there's meant to be this multi-layered system working to protect your sensitive information.
It's not just about ticking boxes for compliance. It's designed to guard against those various threats, the human ones, the tech failures, even natural events. It's fundamentally about building and maintaining trust as healthcare becomes more digital.
That trust is absolutely essential for the whole system to work effectively and for patients to feel safe.
So, just to recap this deep dive, we looked at the threats facing your health data, the crucial role of Indian laws like the IT Act and DPDP Act alongside NHAO HFW rules. We explored the technical defenses, encryption, access controls, logging the importance of anonymization, and how standards like FHIR build security right in.
These are all the components, the layers, intended to safeguard your health information in this digital transformation.
Which brings us to a final thought for you to consider. There's this constant balancing act, isn't there? Using health data for vital research, for improving public health, that's incredibly valuable. But protecting your individual privacy is paramount.
It's a real tension.
So, thinking about that balance, what role do you see for yourself? How can individuals like you contribute to understanding, maybe even advocating for, the strong data governance that's needed? How do we collectively strengthen that trust that's so vital for a digitally advanced and healthy India? Something to think about.